Okay, so today we'll learn about ABG analysis. So, what exactly is ABG? ABG is a crucial tool in assessing and managing a patient's respiratory and metabolic state. So, it's a crucial tool in assessing and managing a patient's respiratory and metabolic state. So, what is the full form? The full form of ABG is arterial blood gas. So, today we are going to learn arterial blood gas analysis and the components which are involved in this analysis. So, there are multiple key components, and the most important out of them is the pH. So when we discuss the component, we'll discuss the normal range. So normal pH range is from 7.35 to 7.45, and what is the significance of this pH? This pH indicates the acidity and the alkalinity of blood. So how do we manage this pH? So deviations indicate acidosis. If the pH is less than 7.35, or they can indicate alkalosis if the pH is more than 7.45. So acidosis and alkalosis. Less than 7.35 is acidosis, more than 7.45 is alkalosis. So if we find any of them, it will prompt an evaluation of respiratory and metabolic contributions to imbalance. So we will look for answers that why acidosis or alkalosis is happening. So next component is partial pressure of carbon dioxide, PaCO2. That's how we write it. Partial pressure of carbon dioxide. So what is the normal range of PaCO2? So the normal range is between 35 to 50 mmHg, which is 4.5 to 6 kilopascals. What is the significance of this PaCO2? It reflects the respiratory component of acid-base balance. Reflects the respiratory component of acid-base balance. And next, the management. So first, elevated PaCO2. What is PaCO2? So elevated PaCO2 is when the partial pressure of CO2 is more than 50 mmHg. And what does it suggest? So elevated PaCO2 suggests respiratory acidosis. And decreased PaCO2, what is decreased PaCO2? Decreased PaCO2 is when partial pressure of carbon dioxide is less than 35 mm of Hg. And what does decreased PaCO2 suggest? Absolutely right, respiratory alkalosis. So elevated PaCO2, respiratory acidosis. Remember, carbon dioxide is acidic. and decreased PaCO2 represents respiratory alkalosis. So ready for the next component. It is partial pressure of oxygen. So it's written as PaCO2, PaO2, and we'll talk about the normal range. So what is the normal range of PaO2? It is 83 to 105 mmHg and 11 to 14 kPa. So what is the significance of PaO2? So it indicates the level of oxygen in blood. So this indicates the level of oxygen in blood. So what was the significance of PaCO2? In PaCO2 it was showing the respiratory components acidity or alkalinity, and in PaO2 it indicates the level of oxygen in blood. So now management. So what is low PaO2? If the partial pressure of oxygen is less than 83 mm of Hg, we will say that it is low PaO2. And what does it indicate? It indicates hypoxemia. Obviously there is less oxygen in blood, so the body is hypoxemic. So what do we do in hypoxemia? We assess for ventilation and we start oxygen therapy. Next component is bicarbonate, HCO3 negative. It's a chemical formula for bicarbonate. So what is the normal range of bicarbonate? It is 22 to 28 millimole per liter. What is the significance of bicarbonate? It reflects the metabolic component of acid base balance. So what reflected the respiratory component of acid base balance? PaCO2, and bicarbonate reflects the metabolic component of acid base balance. So decreased bicarbonate means metabolic acidosis, and increased bicarbonate would generally mean metabolic alkalosis. So next component is base excess. So what is the normal range for base excess? It is -2 to +2. Very simple, -2 to +2, base excess. What is the significance of base excess? It indicates the amount of excess or insufficient bicarbonate in system. So excess or insufficient bicarbonate in system management would be positive base excess, metabolic alkalosis, or compensation for respiratory acidosis. So negative base excess metabolic acidosis, or compensation for respiratory alkalosis. So our next component is oxygen saturation, SaO2. So before we learned about partial pressure of oxygen in blood, and now it is oxygen saturation. So normal range of oxygen saturation is 95 to 100%. What is the significance? It shows percentage of hemoglobin saturated with oxygen. What is the management? Low saturation of oxygen indicates hypoxemia, much like low PaO2. So what we do is we start oxygen therapy. The next component is lactate. It's a very important one. So what is the normal range of lactate in ABG analysis? So the normal range of lactate is 0.5 to 1. And what is the significance of lactate? It indicates anaerobic metabolism. How do we manage? So if the lactate is elevated, it suggests tissue hypoxia, sepsis, or metabolic conditions. Tissue hypoxia, sepsis, or metabolic conditions. Which prompts further investigations and management. The next component is anion gap. So what is the normal range of anion gap? The normal range of anion gap is 10 to 16 millimole per liter. What is the significance of anion gap? Significance is that it helps identify the cause of metabolic acidosis. We will also talk about the formula in this one. So how do we calculate anion gap? Anion gap is sodium minus chlorine and bicarbonate added together. So sodium minus bracket open chlorine with added with bicarbonate bracket close. What is the management? Management is high anion gap metabolic acidosis, indicates accumulation of unmeasured anions. What are these anions? Lactate, ketoacids, toxins, such as methanol, ethylene glycol. What is the normal anion gap? Metabolic acidosis. So it is often due to number 1, GI bicarbonate losses, example diarrhea and vomiting. And renal tubular acidosis. The next component is chloride, which we often tend to ignore. So what is the normal range for chloride? It is 98 to 107 millimole per liter. What is the significance of chloride? So basically it's an essential electrolyte and it helps maintain osmotic pressure and of course the acid base balance. So the management: hyperchloremia, can be seen in cases of dehydration, renal dysfunction, and hyperchloremic metabolic acidosis. Hypochloremia can occur with fluid loss, example vomiting, diuretics. And it leads to metabolic alkalosis. So let us revise ABG analysis. So it's a crucial tool in assessing and managing a patient's respiratory and metabolic status. The key components are the pH. 7.35 to 45 is its normal range. Significance is that it indicates the acidity and alkalinity of blood. Management is the deviations that indicate acidosis and alkalosis. Less than 7.35 would be acidosis, more than 7.45 would be alkalosis, and we need to find the cause of this distribution. Or next point is partial pressure of carbon dioxide. Normal range would be 35 to 50 mmHg or 4.5 to 6 kPa. Significance reflects the respiratory component of acid-base balance. Management is elevated PaCO2 is respiratory acidosis, decreased PaCO2 is respiratory alkalosis. Partial pressure of oxygen, normal range is 83 to 105. Significance indicates the levels of oxygen in blood. Management, low PaO2 less than 83 mmHg indicates hypoxemia, and if there is hypoxemia we need to ventilate and go for oxygen therapy and so on. Bicarbonate, normal range is 22 to 28 and it reflects the metabolic component of acid-base balance. What reflected the respiratory component of acid-base balance? PaCO2. So if bicarbonate is down, it means acidosis. If bicarbonate is up, it means metabolic alkalosis. So base excess, normal range -2 to +2, and it indicates the amount of bicarbonate in the system if it is excess or insufficient. So if it is positive, metabolic alkalosis or compensation for respiratory acidosis; negative, metabolic acidosis or compensation for respiratory alkalosis. Oxygen saturation, normal range 98 to 100%. It indicates the percentage of hemoglobin saturated with oxygen, and low SaO2 means hypoxemia and oxygen therapy would be required. Lactate is very important. Normal range is 0.5 to 1. Significance is that indicates anaerobic metabolism. Management is elevated lactate would suggest tissue hypoxia, sepsis, metabolic conditions, and we need to further investigate. Anion gap, normal range is 10 to 16. Significance, it helps to identify the cause of metabolic acidosis. Formula is sodium minus chlorine plus bicarbonate, and then high anion gap metabolic acidosis indicates accumulation of unmeasured anions, lactate, ketoacidosis and toxins. And normal anion gap hyperchloremic metabolic acidosis is often due to GI bicarbonate loss, example diarrhea, or renal tubular acidosis. So this finishes our ABG analysis and its components.